All right. Hello, everyone. My name is Jake Carlson, and I'm the Director of Deep Blue Repository and Research Data Services at the University of Michigan Library. Title's a bit of a mouthful, but in essence, my job is to help researchers share their data and other scholarly materials in ways that comply with federal requirements and increase their professional reputations. I'm also a part of the working group for the University of Michigan's Research Data Stewardship Initiative, or RDSI. And the purpose of RDSI is to help researchers improve the transparency, rigor, and impact of the research and scholarship across all disciplines by providing resources and guidance around data management. And if you haven't already, I encourage you to check out the RDSI website for more information about the initiative and the related resources. We're thrilled to have you all here today for the last session of our fall seminar series, in which we're hearing from a couple of faculty who have expertise on data management and sharing. During our time today, I encourage you to add your questions in the Q&A box, and you'll have the opportunity to raise your hand to ask questions during our designated Q&A time after each presentation. Our first speaker today is John Allison. He's the William F. Hosford Collegiate Professor of Materials Science and Engineering, and he is PI and Director of the DOE BES-funded Center for Predictive Integrated Structural Materials Science, or PRISMS. He joined the faculty in September 2010. Prior to that, he was a member of the research staff at the Ford Motor Company, where he was employed for 27 years. Dr. Allison is a member of the National Academy of Engineering, a fellow of 2 global materials societies, and a past member of the U.S. National Material Advisory Board. He's provided leadership for a number of influential National Academy and professional scholarly societies dealing with the acceleration of materials development process. His area of scholarship is the physical metallurgy of light alloys. And today, Dr. Allison will be presenting on the Materials Commons, establishing a repository collaboration platform for highly heterogeneous data on the frontier of an emerging data community. And I'd like to turn it over to John now to get started.
Great, thank you, Jake. Let me see if I can, let's see, somebody has to give me permissions here. There we go. Okay, is that good to go? Good. You can hear me okay? Okay.
Yep, all good.
Yeah, so thank you very much, Jake, for that nice introduction. And thank you as well, and Nick Whittingham and the rest of the RDSI steering committee for guiding this, what I think is an important initiative. A little bit daunted to join this as a seminar speaker, especially after hearing Maggie Levinson's talk a month ago, where she has this enormous ICPSR community and repository, et cetera, and representing a much smaller version of the same thing. And so, although I suspect we're as heterogeneous as her communities, but we're since she's been in existence for 60 years, our community's really only been around for about 10 years. So I feel a little bit like we're on the wild, wild west before the Homestead Act of 1862, which provided incentives. So the problem that faces material scientists and engineers is it takes 10 to 20 years to discover, develop, and deploy new materials for engineering applications. And this really limits our ability to use new materials to effectively solve important societal needs. I need to move my thing here so I can see my screen. There we go. And so this is something that the head of the Air Force Materials Lab put together in a presentation about 10 years ago that talked about what we call the materials technology valley of death. So there's a lot of activity initially with a new material. Then there's 12 to 20 years of sort of dead space, and sometimes materials just don't make it, and if they make it over, they go ahead. So you can imagine here there's a lot of data, a lot of government programs that get generated in this time frame, and then maybe that data just disappears until we get out here and start to mature things. So that's an opportunity. There we go. So on this accelerated maturation of materials, if you will, this has been a long-standing issue that the materials community has dealt with, and many studies, been involved in a few. When I was at Ford, we developed some technology and some approaches that helped solve this somewhat. Many other studies. And finally, the materials community felt that we were at a tipping point, that we had enough of these studies. And we were fortunate to get the eyes of the White House and the Office of Science and Technology Policy, who launched the Materials Genome Initiative. And President Barack Obama, well, about 11 years ago now, launched this initiative to discover, develop, manufacture, and deploy advanced materials at least twice as fast as possible and at a fraction of the cost. And the components of that had to do with computational tools and experimental tools and digital data, as you see here, that comprise this materials innovation infrastructure. And it meant a lot of focus on open source, open sharing of data, and really working, sharing, and sort of team focused in a way that we had never done before in the materials community. And I have to say, there's been about $1 billion, this is my number, so don't take it to the bank, expended in MGI related research over that 10 years. And made enormous progress on computational tools and experimental tools, not so much about digital data, in my opinion. And part of that is that the government agencies have only put about 1 to 2% of this $1 billion into data repositories. And so you'll hear me talk more about that. So we were fortunate, as this launched, to be awarded a Department of Energy Basic Energy Science Software Innovation Center grant. It's been in existence since 2012. This is the Prism Center. So we have 8 faculty and 4 research staff. We've garnered about $23 million over that period of time, and we're up for renewal next year again. We go through 3-year renewal cycles like everybody else in soft money. We've made enormous progress on the computational tools and on our science. I won't talk about that. But what I want to talk about is our other thrust, the materials commons. And so this is our notion of having a collaboration platform and a data repository that's a seamless and continuous part of the scientific workflow for both experimental and simulation information. And it's a way to build collaborations and accelerate model building and validation. The team that's brought the materials commons forward and continues to is the lead developer is Glenn Tarcia. He, I believe, is on the line. And domain specialists, Tracy Berman, who's our experimental domain scientist, and Brian Puchala, who's our computational domain scientist. And I want to acknowledge at the very beginning, 2 of our colleagues, Margaret Hedstrom, who's of course now, for those who knew her, now retired, an emeritus, and Jag Jagadish, who of course leads our data science center activity or institute. And they were very helpful. So to talk a little bit about, put this in context, why we talk about heterogeneous nature of materials data. So when I was at Ford, I did a lot of work on cast powertrain components, engine blocks made of aluminum. And if we take a little section of that and look at it under an optical microscope, we see these sorts of features, grains, and these all have terminology associated with them, and they affect properties. If we go a little bit higher magnification in optical microscopy or scanning electron microscopy, we see additional phases. If we take a little tiny foil in one of these white areas, it's called an alpha grain, put it in a transmission electron microscope, we see this nanostructure precipitates that provide the strength for these materials. If we go to high resolution transmission electron microscopy, we can see the interface between these precipitates and the matrix. And all of these are very important elements to defining this particular alloy that we have characterized at Ford for this we call virtual aluminum castings. So the point is, to really fully understand a material, information is required at many length scales, and each of these levels can be affected by the manufacturing history and the alloy details. So if we heat treat it a little bit differently, put a pinch more of copper or a pinch less of manganese, this changes. And so we have to understand that as we go. So you can see already that for a given material, this is a very heterogeneous problem. To acquire data, we use tens of thousands of different instruments. So we use high energy synchrotrons, electron microscopes of a wide variety, mechanical testing, et cetera, et cetera. So we have this, and we probably have thousands of people doing these experiments. So very heterogeneous data problem. And this is for one material. There are over 100,000 engineering materials. And for each of these materials, they have different and hundreds of different phenomena, many of which are poorly understood. So that's the domain that the Materials Commons is trying to reach, if you will. And we're doing this, we've been doing this since we launched our first version of this in 2016, Materials Commons 1.0. And after several years, we concluded that we needed to do some things differently. Pardon me. So we launched about 2 years ago, Materials Commons 2.0, and you see our splash page here. To date, we have about 650 registered users. So, you know, at a population of maybe thousands, I don't know what the ultimate could be, 5,000, 10,000, we're a very small part of the potential audience for this. About 26 terabytes of data have been uploaded since 2016, smaller than we had thought and we would hope, and certainly smaller than the materials community generates, much smaller. We have a private site and a public site. So we have this, it's meant to sort of pull people in. We have an electronic lab notebook for individuals to use on their own or with their students. A collaboration site, which we use in our Prism Center and our scientific use cases or others could use. And then when the data is ready to be published with the push of a button, it becomes public. And we mint DOIs and so on and so forth. That public data has been viewed over 14,000 times, about 7,000 downloads. We aspire to the FAIR principles. So our data is findable. So everything has a DOI and data and well-described metadata. Google data sets they're automatically discoverable by Google data sets, et cetera. They're accessible, of course, by DOIs with publications. People use their DOIs in the publications, and we have a very well-maintained site. I must say, my hat again off to Glenn Tarcia, who's the lead developer. When we transitioned from Materials Commons 1.0 to 2.0, we were down for about 8 hours over a weekend while he transitioned everything. So he'd done a lot. So it's a very well-maintained site. It's interoperable, so full-featured command line interface and application program interface for interfacing with software or other repositories and so forth. And of course, it's all reusable. So we use the Commons licenses, Data Commons licenses, and all the data and well-described data, et cetera. We focus on ease of use and usefulness, organizing and viewing information, both experimental and simulation. A lot of activity on documentation and training. So we have an annual workshop for the entire Prism Center, and we typically get 30 or 40 people that we also train for Materials Commons. During COVID, we launched a YouTube channel for the Prism Center, and that's had over 17,000 views, I think. We have many different aspects. I won't have time to get into it, but we have a Globus interface option for these very large data sets from synchrotrons and so forth. And then something we've been working on for the last year are Materials Commons communities to build awareness, standards, and curation of data. So just a couple of screenshots from the Materials Commons 2.0, so we can view data, workflow, and file relationships, comparing different samples, see what's different about them, and have a very sophisticated search feature. Similarly, when we publish a data set, you can search on published data sets, browse tags, and so on and so forth, and download over the web. The Materials Commons communities, we think, are an important way to add value and build communities. We don't have the resources, so curation is very much an individual investigator. When they put data up, it's their data. But we think curation can happen by crowd curation. That's the only thing we're resourced for, certainly. And that's a way also to add value and build the community. So this, we'll be developing new tools for this Materials Commons communities to prosper, if you will. In terms of areas of active development, we're really trying to focus on tools that enable improvements in science. Again, we're trying to get people to use it as part of their normal workflow. So we have a number of ideas and activities on advanced visualization, making data available for machine learning. It's an enormous opportunity for data, but when you look at that problem, you say, where are you going to get the data? And so we think repositories such as the Materials Commons are a way to get that data. Visualization and comparisons of multimodal data. As I said, we might have experiments and simulations of the same problem. You'd like to fuse that data or different microscopy techniques. And then again, developing community curation tools. We're part of a National Science Foundation funded National Science Data Fabric pilot program led by the University of Utah. We're sort of the materials domain guinea pigs, if you will. They have a number of different domains. And one of the things we want to get out of that is commons on the cloud. So you can put your data in the cloud and then access it within the Materials Commons. And so that's a way for people who only want to use it for collaboration to have their own data storage and just use the Materials Commons as their interface with that data. And of course, we're always focused on outreach. That's a very important part of what we do. So to sort of turn this, so why do you care? You're not metallurgists. Why do you care about the materials domain? So here's some thoughts for sort of future discussions. So sustainable infrastructure, if you're a burgeoning repository, it's something to think about. We started off with, we were lucky, we had a good chunk of change from Department of Energy. So we went out and bought 490 terabytes of Isilon storage. But after 8 years, that started to die out, and ARC was tired of maintaining it. So we made arrangements. We transitioned everything over to turbo storage and locker, and that's where we are now. But at a certain point for our budgets, that gets to be a bit pricey if we really look long term, and that's maybe 5 or 6 years out. When we start getting enough storage that becomes a problem, an expensive problem. So one of the things we're looking at now is the ARC Active Archive. So we have that set up now, and we're sort of seeing if that gives us the response we want. But long terms, I'm wondering, is there a better long-term university funded or governmented funded solution? Right now, if you look at these publicly funded repositories, the government is not adequately funding them at all, certainly not in the materials community. And so that's something to think about. Materials Commons is an open source code, so it's available for other domains who wish to modify and use it. Is there interest in this within the U of M community? When we started Materials Commons, we looked around and couldn't find anything that we might just pick up. When we transitioned from Materials Commons 2.0, we looked and said, you know, if there's some other piece of code out there that we could use for this, we'd be happy to. But we couldn't find it. Of course, about 6 months after that, I met Maggie Levinson and heard about Turbo Curator. So maybe that's would have been the solution. I don't know. But at any rate, we have Materials Commons 2.0 now, and we think that's good. But we'd certainly be willing to make that available to others. Bit broader, domain-specific repositories, I think, add value. And so I think Deep Blue repository is fabulous, but it doesn't build community. It doesn't add the value of a collective of information. You have to know where to find it and so forth. The problem is there's no incentives or mandates that encourage or require sharing of data. There are certainly no incentives or mandates that encourage or require use of domain-oriented repositories. Will the August OSTP memo really change this? I hope so, but you know, it won't launch really until 2025. That's after the next election. So if I'm not a believer in the government agencies, maybe I wait. And, I think the rest of us hope that Joe Biden, for no other reason, gets reelected in a couple of years, because who knows what happens to OSTP in 2025. If you haven't read that memo, that's the end date when the government-funded agencies have to come up with a plan. But when I looked at the NIH webinar last time, I didn't really feel like I got the feeling that that was a really strong mandate or even incentives for sharing data. So we'll see. And this is the real point I want to get to, and I see my time is getting very short here, so I'll wrap up. Encouraging and supporting high-quality domain-specific repositories may be an opportunity for Michigan to achieve research data leadership. So compliance is wonderful, and a lot of what this RDSI is focused on is making sure we're ready for this August 2022, and that's wonderful. But I think we should have the opportunity at least to aspire to more, to a real leadership. And I think domain-specific, having a collection of domain-specific repositories, sort of Dryad, for those who are familiar with that in the California system on steroids, is something that we have the capability, especially with ICPSR in our hip pocket, to think about. So with that, let's see, I will just let you read these summary comments as I see my time is up, and open this up for questions.
Great, thank you, John. Fantastic presentations. Lots of things to consider with regards to sharing data and building public repositories to make data available. As John said, we'd like to open up for questions at this point. You can either type your question into the Q&A box or raise your hand to ask your question live.
I'll kick us off if you don't mind, John. So that was really interesting, tying sort of some of your work into the new 2022 OSTP memo, as well as the data sharing component. As you, I'm sure, know, the other major component of that memo is the immediate release of research results in terms of the publications. And so I was wondering if you could talk a little bit, not only about how the data sharing shifts might affect your area of expertise, but also access to these publications immediately, because I know Alondra Nelson, who wrote the memo, one of her big goals is increasing equality and access to this kind of data. So could you talk a little bit more about that?
Well, so my sense is generally the materials committee, there are certain exceptions to this, certainly. The surveys we've seen are certainly willing to share their information in a timely fashion. So I don't perceive that, and I know we have discounts with all the major for doing open access publications. I've looked at the website here, and we have discounts for the major publications. So I don't perceive that as a barrier, to be honest. And we have the ability to allow people to embargo data within the materials commons, but it's not something that people have really felt the need for, I think. So I'm not too concerned about that from my experience. There's enough interest in sharing data. The problem is it's work that people don't value the effort that they have to put into doing that. So they're certainly willing to share their data and put a tag on there. So my fundamental thing here is that the data management plans are not really enforced in any serious way, and pretty much if you say I'll make my data available, that's sufficient, at least right now, and I'm not sure that how much that will change. So yeah.
All right, I think we have time for one more question before we go on to our second presenter. Okay, well, I have a question actually, if nobody else does. So, John, you mentioned you talked a bit about data curation, and the data that are submitted to you aren't curated by your staff, but instead opened up into to a crowd-based curation system. So, curation, I mean, there's a bunch of different definitions for it, but essentially, it's preparing the data to be used by others and to have value for the larger community. How do you find the crowd curation approach to work for you? Are you getting people who are making changes or suggesting changes to the data set for the larger purpose?
Not much. Yeah, I wish it were more. We get a few comments. We certainly have the ability to comment on data, and we don't really track that, but we don't see very much of that. I think, I certainly don't see very much of it in the data that I post. So certainly every paper that I put out has got data in materials comments, and I rarely see anything back from that. I think these communities are new enough for us that we haven't really pushed that, and so we'll be pushing that more as we go, and that's where I think we'll go. I mean, there's obviously a certain amount of curation just to get the data up there in a recognizable way, but yeah.
Yeah. Okay. Great. Thank you for that response.
You bet.
I think we need to switch over to the second presentation. We do have a couple other questions that have come in, but we'll have some time at the end to ask those as well. So our second presentation is from Professor Kayte Spector-Bagdady. She is an assistant professor of obstetrics and gynecology and interim co-director of the Center for Bioethics and Social Sciences in Medicine at the University of Michigan Medical School. A lawyer and bioethicist by training, the overarching goal of Professor Spector's work is improving the governance of secondary research with health data and specimens. She's currently the PI of a KO1 from the National Human Genome Research Institute and an RO1 from the National Center for Advancing Translational Sciences. Her recent articles have been published in the New England Journal of Medicine, in JAMA, and Science, among others. Previously, Professor Spector-Bagdady was an associate director for President Obama's Presidential Commission for the Study of Bioethical Issues and a practicing drug and device attorney. We'll be hearing from her on increasing the demographic diversity of research data banks. Professor, over to you.
Thanks so much for that introduction. So before we started this seminar, we were trying to figure out, John and I were trying to figure out what the connection was between our two talks, and I think I found it. It's that we're both going to talk about Obama initiatives. So I'm going to start my talk by talking about the Precision Medicine Initiative that was launched under the Obama administration, and specifically its All of Us research program. And so the All of Us research program really represented sort of the crown jewel of the federal precision medicine program, in that the concept was to launch this bio and data bank that would be incredibly diverse and would allow for all sorts of different demographics to be represented, such that research with these data would be either more generalizable across populations or specifically targeted at populations, at improving the health of populations that have been historically excluded. So that was sort of the vision of the All of Us research program. But there have been some challenges that I'd like to talk about that I think are applicable to much of the research and the data gathering that we're doing at the University of Michigan. And I'll use the University of Michigan and our MGI program, which stands for the Michigan Genomics Initiative, as an example. So one challenge that I'm going to briefly touch on as a lawyer is the law. And you guys on this webinar probably know this, but one thing that really sets us apart from Europe and other countries that are doing data governance is the fact that we largely regulate health data by how those health data entered the system, right? So we regulate clinical data under HIPAA. We regulate human subjects research-derived data under the Common Rule. And maybe we regulate commercial data under maybe a little bit of FDA, a little bit of FTC, a little bit of CMS. It's largely unregulated. But the most important point to take away from this slide is that all of our regulations apply by how data comes into the system, which made a lot of sense when data was written down on a piece of paper and then put in a folder and stored on a shelf. I remember my first job in a hospital was long enough ago that one of my jobs was to actually get the folder off the shelf of the patient record and give it to the patient before they walked in to see the clinician. But that's not the way health data works anymore. And it's constantly changing hands. And we know that hospitals are increasingly commercializing patient data and selling or sharing data with commercial entities, usually de-identified. And then we also know that academic researchers are increasingly using private data sets for their work. So this is an example of US academic researchers using private genetic data. So these are the big main DTC genetic testing companies, and this is researchers publishing with this data. And as you can see on the bottom line, that bottom square is private researchers publishing with private data. So think like 23andMe, Color Genomics, and that top line is the increasing use of private genetic data in the public peer-reviewed literature, and that middle green line is academics. So you can see that academics are really pushing this upward. And these data end in 2017, but we actually just had a summer intern, it's not published yet, but redo all these data, and the increase continues. So that's academics using private data. And then also there have been invented these companies that their entire job is to collect all this commercial data that is either health data or health proxy data. Like an example of health proxy data would be, you know, if I have geolocation data that shows that I drive from my work to the bar every day, then that is potentially health-related information. And these commercial entities, they gather up this health and health proxy data, which has been commercially assembled under basically no regulation, can de-identify it and actually sell it back to academic researchers and others to use for their research in ways that they couldn't have collected it in the first place. The second major challenge, and the one that's the focus of this talk, is sort of the demographic disparities that we see in these data, particularly private data sets, and how that impacts our work and our research. So there's lots of different layers of disparities in health access that are relevant to ultimate demographic variation in our research data sets. The first one being that many of these data sets are pay to play to begin with, right? You have to have health insurance, you have to have access to healthcare, you have to have paid for a clinical test, you have to have paid for a direct-to-consumer genetic test. There's often money involved. But then there's also disparities in participants who are recruited for research, and then differences in the types of participants that consent to research. So those are the two that I'm going to focus on for a second. So we recently published this piece with Jenna Wiens and Sachin Ketapal and Chad Brumman and a bunch of good people from around here at Michigan, and we looked specifically at the MGI, so the Genomics Initiative data bank here, and we looked at the demographics that were represented. And one of the major findings was that the type of participants that we were recruiting to enroll in MGI were quite different on the basis of race and ethnicity specifically. So you can see here that our overall patient population of Michigan medicine is 70% white. But at the time we did this analysis, about 87% of our MGI database was white. And this highlights a really interesting tension because, you know, the step that's in between just being a patient and being enrolled in MGI is this thorough consent process, right? So on one hand, you could argue, well, we're respecting patients' autonomy better by intervening with this informed consent step and ensuring that they really know what's going on with their research. So yay, autonomy. But on the other hand, if our major goal is, say, justice in one concept of the word, and we want to enable our research to be as generalizable as possible across historically excluded communities, you could see where you might think, well, gee, maybe the right answer is not to ask for informed consent and just use everybody's data for research. And this is those same data represented a little bit differently, but so that cohort on the left is Michigan medicine, so that's all of our patients, and the column on the right is people who were recruited, people who were approached to enroll. So, you know, this was not, as far as we could tell, have anything to do with any sort of bias or racism on the part of the people who were trying to recruit people into research. It was largely related to the fact that at the time, MGI had been designed to recruit in pre-op, right? And this made sense for a lot of different reasons, including several best practices in recruitment for research, which is to find patients who have time, not to interrupt the clinical workflow, and to recruit patients who are giving samples anyway, right? So you're not adding an additional layer of complexity or intervention. So that's why recruitment had been designed in pre-op, but of course, you know, now we know, and has been found in the past in other settings, that the people who are sitting for an elective operation, right, this isn't an emergent traumatic operation, if you're sitting there and you have time to give informed consent, are much more likely to be wealthy, white, older men with health insurance. And that, in fact, is what we found. And I will just say that since then, MGI has opened its recruitment up a lot and has increased the diversity of their demographics. And then the other thing that we found was that there are differences in participants that consent to research. And at least in our University of Michigan example, we found that if they were approached to consent, our Black or African American, Asian, and Hispanic patients were much less likely to consent to research when approached. So both of those differences and disparities went in the same way, right? We were more likely to recruit wealthier white patients, and then they were more likely to consent when we recruited them. And this becomes even more complicated when we're talking about data commercialization, because as you can see here, you know, most people are uncomfortable with entities commercializing their health information, and they definitely at least want to know. And this is another piece that recently came out that's over a much larger diverse population. And this is a complicated slide, but the punchline of it is that people want to know if commercial or university researchers are using either their identified or de-identified specimens or health information. We also found that people are more likely to want notice if it's commercial versus academic use, if it's identified versus de-identified, which of course makes sense. And also they're more likely to want to know if it's health information as opposed to specimens, which actually was a unique finding because, not to get too wonky, but the federal government has been assuming for quite some time, since The Immortal Life of Henrietta Lacks came out, that people actually are more worried about their specimens than their health information. But we actually found the opposite, both overall and in a Black and African American population specifically. So what's the impact of all of these differences and preferences and disparities in recruitment and access? So in genetics specifically, because that's where I focus, there's a lot of impact. Sorry, and there's not that much diversity in data in terms of ancestral origin, right? And so recent studies have found that over 80% of the population is either white or Asian. And when you're looking at people of African ancestry and Pacific Islander and Native ancestries, we're down to under 4%. And in fact, this was also true for NHGRI, so the Genomics Institute of NIH's genetic-wide association database specifically. So a very small number of people who are demographically diverse. And this can have actual impacts on health. And I want to spend 1 second clarifying the difference between self-identified race and ethnicity and ancestry in this space, because there's a long history of using self-identified race and ethnicity to promulgate racist assumptions that diseases and disorders behave differently in white people versus Black and African American people on the sole basis of the color of their skin. That, in fact, was one of the main reasons that the Tuskegee syphilis studies, the syphilis studies that were conducted by the U.S. Public Health Service and Tuskegee were started, was this assumption that clearly Black and white people are so different that syphilis must behave differently in Black people. So that is a racist assumption that we are putting aside for now. And we're looking specifically at sort of ancestral diversity and variants on the genome that have been, in limited circumstances, found to make drugs or devices act differently. So, for example, there's a lot more variants of unknown significance in historically excluded populations, which means variants on the genome that we don't know how, like what the intersection between health behavior and health outcomes will be. We also have histories of giving people incorrect results, things that are correct for a European ancestry population, which might not be correct for a Pacific Islander or an African-derived population. And this lack of diversity, you know, hopefully I don't have to argue why a lack of diversity is important, but this lack of diversity is bad for everybody. Because not only does it mean that historically excluded communities end up continuing to be historically excluded from our research results, but we also know that the majority of genetic variants specifically occurs in those of African ancestry. And so this is an example from one of our GWAS data sets in the government, that while people of African ancestry only comprise 2.4% of participants, they actually contributed to 7% of the associations people were able to demonstrate between variants and diseases and disorders. So it's bad for the entire community, no matter how you look at it. I'm going to quickly wrap this up, but some ways to try to improve upon this includes hospital policies. So we at the University of Michigan have a new one where we're trying to focus on ensuring that we're only sharing data that has been fully consented. We're working currently on ensuring that our patient consent is up to the same level as our research. Professional organizations have also taken the lead in this space. Our funders, NIH, are also trying to recruit and ensure the recruitment of diverse populations. And last, there's always journals who might or might not publish if things don't meet certain levels of diversity and data sharing. Thank you.
Thank you, Kate. That was a fascinating presentation and very detailed about a lot of
fast.
really important. No, but I'm really glad we recorded that, because I want to go back and look at it again, because there's such a richness, I think, to your presentation and the depth of examination that you did for your subject. So thank you again. Questions for Kate? I see we have Aaron Kaliba. I'm going to unmute you, Aaron. Go ahead.
Yeah, can you guys hear me okay?
Yep.
Great. Thank you so much, Kate and John, earlier for those fantastic presentations. So, Kate, you know, to address this idea that our homegrown resource here, this Michigan Genomics Initiative, is not representative, you know, I feel like if we continue to only do research on consented individuals, we will continue to produce evidence on what works for white men. However, I mean, so do we work on two fronts? Do we continue to develop evidence because we have it, and also continue to, on the other side, recruit and have different recruitment techniques? I mean, I don't want to not use the database, but it is limited. So do you want to work on recruitment and continue to, what do you think?
Yeah, that's the rub, right, Erin? So I know that MGI has been doing a lot of really creative things with increasing and diversifying their recruitment by, for example, doing it by mail, allowing people to leave with test kits and send in biospecimens, which is a way to get around the fact so the more timing. And so you don't have to catch them during a blood draw, which is often privileged to be able to get a blood draw. But to your point, well, what do we do with all the data we have? I mean, I certainly think we should certainly be continuing to do research with it. I think we should consider whether we need that extra MGI, whether we need that extra biospecimen, or whether we can be doing research with the research data warehouse, which is all of our all of our patients represented, although, Michigan is largely white, even in comparison, nationally. And then the third thing I would advise is, so we're working on recruitment, we're thinking about how we can use more diverse patient cohorts here. And the third thing that I would advise is that researchers actually work with other databases like the All of Us research program who have cohorts of more diverse populations, and that way we can combine, I know we can't do this in all circumstances, but ideally we would be able to combine smaller databases of more diverse cohorts with our larger ones to sort of reaffirm signals that we're seeing in our larger database with smaller diversity. Does that help?
Yeah, I love that. Yeah, those three approaches make sense. Thanks, Kate.
Yeah, thanks, Erin.
All right, we do have another question that came through. Kate, are there costs associated with these new recruitment strategies? So you've laid out the reasons for why this is the right thing to do, but will the cost be on researchers, the institutions, the NIH?
Yeah. Yeah, I mean, so that's tough. So I will say like Ruha Benjamin and other colleagues have done some really deep dives into engaging with the community and how to ensure the enrollment of historically excluded populations. And what they have found time and again is that education, building relationships are really the most effective, however, are also the most expensive, and don't usually result in, hundreds of thousands of people being recruited in that way, which is, really needed is in particular for genetics research. So yes, there is an expense. I can't rattle off exactly the expenses associated with the differences in MGI recruitment, but I think one of the balances they were trying to achieve is still being able to recruit large numbers such that we can enable research, while still doing something that is affordable enough that we can continue to do it. Because yeah, that balance of benefits and burdens is really hard.
Yeah, absolutely. We do have another question. This is actually for both
Kate.
Kate.
John has his hand up too.
Oh, I'm sorry. Go ahead, John.
There I am. I'm unmuted. Yeah, thank you. I wanted to sort of get a sense of the scale of the data, how many individual patients, how many terabytes of data this is. And in particular, I'm assuming that MGI, you hope your MGI goes on forever, I assume, but what do you do when that program no longer is funded? Where does that data go? Is it still something that you can store somewhere and get access to, that researchers can get access to it?
Yeah, so I am not one of the MGI researchers. They just allowed me to do this sort of extraneous ethics project. So certainly if there's somebody from MGI on the call, I'd be happy for them to pipe up.
Okay, thank you.
Sorry.
Yeah, no,
I don't have all that data at my fingertips.
Yeah, that's fine. Yeah.
Well, John, while we have you on the screen, we have a question for you. Would you be willing to share the code publicly of the Materials Commons repository? I know there are a lot of national demand for domain repositories, and other institutions might be able to host them, though it's certainly preferred if Michigan hosted them. The Globus intake in particular sounds great.
Yeah, it's available on GitHub. Yeah, I mean, it's available now, so certainly it can be found now, and so the one area we shied away from is having instantiations for the use in materials, just because we don't have the wherewithal. I mean, we're one person basically activity, so we've got to be careful about overloading Glenn, but certainly making that available to others is certainly. We treat it so. Our other software, the Prism software, are things that we actively try to get users, and so there we've got 6,000 at least downloads, unique clones. But with the Materials Commons, because of its nature, it's more appropriate for us to provide it in open source, sort of in an unsupported way. Does that help?
I think so.
Yeah.
Is the GitHub link on your site someplace that people could find it?
Just Google Materials Commons GitHub. We can certainly make that available. Don't think it's maybe on the Prism site. I don't know if Glenn is here. If you can unmute him, he can tell you. But I think if you Google GitHub Materials Commons, you'll find it.
Great, thanks.
Yeah.
Okay. Let's see. And a question for you both. The OSTP memo that both of you mentioned really centers on public access to research publications and data as an equity issue. But there has been a bit of pushback or open questioning about some of the unintended consequences of the memo, or the resulting changes to agency policies, such as shifting it onto researchers, which may disadvantage certain disciplines, or early career researchers, or universities with lower research activities. How are you seeing this play out in terms of impacts on researchers in your domains?
I might take a shot at that. So, you know, I talked about our National Science Data Fabric pilot program with the University of Utah. So certainly one of the ideas there is democratization of large data. I mean, they have a dictionary of 150 petabytes. And we have a part of that is University of Texas, El Paso is a partner. And so they largely minority serving Hispanics in Texas. And so we try to work with them to set up courses in materials that access this data. So certainly the data is widely available to anyone. That's in Materials Commons. In terms of uploading data, I don't know that would be a limitation for anyone that has the will to do it. It's really not that difficult. So yeah, I'm not sure that that's a democratization issue at all, personally. Yeah, if I understood the question right.
Yeah, so I mean, it's interesting because there's new parts of that memo and then there are not new parts of that memo. And it has been true for decades that federally funded researchers were supposed to release their data supporting published work at the time of publication, especially in the genetics community. But since 2013, so the Obama 2013 OSTP memo, which is the Office of Science, Technology, and Policy, which is part of the White House as opposed to the NIH. So this covers all departments and agencies with a research and development budget. In 2013 is when they set the 12-month embargo period. And I think the real shocking thing for the research community is that change from 12-month embargo period to 0, to the immediate release of the articles and not just the data. And it's interesting because Dr. Nelson did in fact frame that as an equity issue, but the scope was limited, right? She saw it as an equity issue of researchers who couldn't access other people's finding in a timely manner, as opposed to equity, as we've been talking about, which is representativeness of the data to begin with. And whether actually ensuring that diverse communities have access to the publications results in more or less equity in the data, I don't know. But I agree that it might have actually the opposite effect, right? That we sort of stay away. You know, I don't want to put like a federally funded researcher on my private research team because that means we have to pay like the $10,000 open access fee. I think that there's going to be a lot of things that are going to happen. I'm not entirely sure that they were unanticipated. You know, Alondra's a very smart woman. I think she did anticipate it and said, on the whole, it's better than nothing. But I agree. I think the journal thing is going to be, I think it's going to be explosive in the next couple of years.
I think there's a lot of questions about the different mechanisms and the different costs associated with those mechanisms and how those costs are covered. So I agree with you, Kate. It will be really interesting to see what kinds of initiatives are formed around that and how those resolve.
Yeah, and so, you know, my comments had more to do with sharing of data rather than the publication costs. That's certainly a concern, I would think, in people that are, yeah, that don't have the wherewithal of Michigan to get discounts and so on and so forth. Yeah.
Right. And you pointed this out in your talk, John, that, you know, even though NIH can pay for the person who's cleaning your data to share it, it's the burden, right? I mean, people have to be savvy enough. They have to at least be at the postdoc level to clean that. And what they don't need is money. What they need is time to do their own research as opposed to cleaning data for other people.
Right. And I don't know about if NIH or I know NSF doesn't increase their budget to for people that have expensive data management plans. You just take it out of your hide, and so people just don't do that.
Yeah. Okay, we're winding up. Any other questions? Let's see, we do have one more person with a question. Go ahead, Deb.
Hi, just kind of piggybacking off the last question. I've also been thinking about like NIH in particular. They say you cannot put the archival storage costs in your grant unless you can pay for it upfront before your grant ends. So that's I'm on the storage side of all this, and that's what it is in my mind all the time.
Okay.
Yeah, I mean, I guess I'll just say that I think ideally to NIH, you wouldn't be storing it, they would be. And so largely these things are written from that perspective, but I completely agree that they don't encompass all of the different ways that we share data.
Okay, thank you, everyone. I think it's about time to wrap up. This is the last RDSI seminar for the fall, but watch this space for future offerings from RDSI. We also do want to highlight an upcoming webinar from the NIH, creating a data management plans with the DMP tool, and there's the link for that. That takes place December 13th from 1 to 2 Eastern. Any final thoughts or questions before we go our separate ways?
Thank you, guys. This was fun.
Yeah, thank you.
Okay, thanks, everybody. This was great. Oh, yes, I'm sorry. I have one more slide to share. Thanks for the reminder, Lindsay. And let's see, where is that? Yes, the resources and guidance from the RDSI. So the website is here. We have best practices for stewardship of research data, some resources, and resources for the NIH data management and sharing policy in particular. And the URL is on the bottom of that particular slide. And with that, I think we'll close up for the day. Thank you, everyone.